Wellness for Life is brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.
Hello, I'm Dr. Tom Wilson at Detroit Lakes Chiropractic and Neuropathy Care. And after 4 decades of practice, I'm now in charge of the Neuropathy Care program here with Dr. Johnson in the clinic. And we started this about a year ago, and based after a lot of research, a lot of investigation, and because it's so effective and it's really the only thing that helps neuropathy patients, we implemented this in the office. And one of the things I'd like people to know is some people have a question of, well, I've been to a chiropractor or a physical therapist or something like that and it didn't help. This is not traditional chiropractic or physical therapy treatment. There's a lot of different things we do in this comprehensive program that enable neuropathy patients to get results that they can't get with anything else. So I want to introduce you to that aspect of the program. So neuropathy is a progressive chronic disease. It's most common in diabetics, but literally there are over 100 causes for neuropathy. And when we say it involves the peripheral nerves, in that case we're talking about your nervous system that comes out of your spine. The peripheral nerves go to your hands and then to your arms and feet. Most people with neuropathy problems have pain and symptoms in their feet, some in their hands. The symptoms may be numbness, may be sharp pain, it may be burning, it may be like your feet are on fire, it may be tingling and numbness. A lot of people get muscle cramps. Some people have one symptom, some people have all the symptoms, and it affects people's quality of life. Sleep can be very difficult for people, standing for prolonged periods or even walking. Some people just can't walk very much. And so there's a lot of different ways it presents, and we do examinations that determine the degree and the extent of the problem. So peripheral nerves of the hands, peripheral nerves of the feet, and that's what we examine to determine what your problem is. Most of the patients that come to us with neuropathy problems have been doctoring with their medical doctor. They've been seeing podiatrists, neurologists, maybe had physical therapy. Unfortunately, none of that really deals with the root cause of neuropathy. Okay, it can mask the symptoms with medication, but it doesn't stop the progression, even though you may get some relief. And that's the same with many of the other treatments that you do. So over the years, I've found that that's kind of what we did with chiropractic here as well. It just masked the symptoms. It didn't really make anybody better for the long term. So we have a process that when we examine patients, we can determine the extent of their problem and how much that problem is causing their symptoms, and really we address the root cause of it. And with neuropathy, we know it's the very deep circulation in the extremities, the hands and the feet, that is impaired. You could have normal pulses on your hands or on your feet, but yet the deep circulation is impaired. So the blood flow to the nerves, the small, tiny microscopic nerves, is compromised. And so those nerves are literally starving and suffocating for oxygen, for nutrients, and then they start to talk, and they talk with the symptoms, the pain, the numbness, the tingling, all these different things. So we have a comprehensive approach that once we know the extent of the problem, the degree of the problem, and if you qualify for a program that we apply to it, it involves in-office care, it involves mostly at home care. 80% of the care is at home with using certain medical devices, neurological stimulation, low-level light therapy that penetrates deep into the tissues and works to expand the circulation by vasodilation, by actually developing new tiny blood vessels. We call that angiogenesis, developing new blood vessels. Then the nerves can get the circulation, the nutrients, and the oxygen they need, and they can recover, and gradually that's what they do. And we monitor that with periodic examination. But the great thing is that most of the care is at home, so you don't have to be running to the doctor all the time, especially after the initial care, which is done in the office once a week to begin with. Okay, so that's kind of our approach to it. We determine what the extent of the problem is and then develop a treatment plan for that individual that's going to get them better. And our success ratio, when people qualify and they are agreeing to do what we need them to do to get better, we have over 90% success. And oftentimes the improvement is within a week or two. Generally, we tell patients to be a little patient. Many times this has taken years to develop, sometimes decades, so you got to have a little patience. But the results are just incredible with a lot of people, so that's kind of the program in the office. So I'd like to have you listen to a few of our patients that we've worked with in the last few months so you can get an idea of what their results are.
I'm sleeping better. My husband says I'm not kicking him all night long while my feet are spasming and jerking me around at night. So I know that my sleep is much better.
And you also feel that your balance has changed some already?
Definitely better. Yeah, I've noticed even when I'm working in the garden, I'm not as apt to feel like I'm going to tip over. So I think it's helped me in a lot of ways, actually.
I've got a lot more feeling in my feet and actually up my leg. I'm not having the tingling that I used to have. And so, walking and so on is a lot better for me because of the more feeling in my feet. And I guess that's the biggest thing. I'm just feeling a lot better about the future.
Right.
about just how my life is going, because, neuropathy kind of takes you down, brings you down emotionally, and so I'm feeling better that way.
It's 4 or 5 weeks into this,
right?
And you were pretty nervous about this whole process.
I was.
You're feeling a lot better about it now, aren't you?
I'm feeling a lot better. I'd recommend it to anybody.
I got Joe here, and he's been in our neuropathy program for a couple, 2-3 weeks, and seeing some progress already, which is great. What are you seeing for changes of the better so far?
Well, my feet are cold a lot less, and the tingling is sporadic, whereas it used to be almost steady.
Okay.
And I feel safer on my feet.
If you'd like more information about neuropathy in our care program, please just call our office, 218-847-4366. If you have questions and would like to have me answer some of them before you make a commitment to do a consultation and perhaps have an examination, I'm happy to call you back and visit with you. We'll be straight with you, and we'll do our best to see if we can't get you help or determine if you don't have neuropathy, because that happens also. So call our office, 218-847-4366. Thank you.
Thank you for watching Wellness for Life. Wellness for Life has been brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.